Welcome back to In Session, Healthcare Policy Deep Dive we're bringing to you every week. I'm Ryan Bernal with the South Carolina Hospital Association, and we're week 10 of the legislative session. Our Senate was in primarily talking about hemp products. The General Assembly is looking to regulate those hemp products. Right now, an individual any age can walk into a convenience store, buy a product with some hemp-derived THC, and there's no state regulation on what's in that product. So we commend them and the House for working on some restrictions on who can purchase, what can be in those products, how they're defined. We don't really have a position on it. We're just eager to see that debate come to a close so that they can get some of our priorities, including the HALO Act. We've talked to y'all a lot about our interest there in protecting healthcare workers. The Senate last week passed out a version of that bill that does not include protections for healthcare workers. So we're really looking to our friends in the Senate to introduce an amendment. We made a lot of headway to include protections for our healthcare workers in that language, as the House did, and expand that beyond just emergency healthcare workers, but everyone that works for our hospitals, providing life-saving care deserves those same protections. So eager for the Senate to get to that debate and see that amendment posted, and ask for you to engage in our grassroots campaign and support those proposed changes as they come up. The Senate Medical Affairs Committee also met in full committee this week and took up a number of bills, including some appointments for various boards. At the top of the order was S299. We've discussed that a couple times now, related to alternative transportation for non-violent behavioral health patients transported between hospitals and other facilities. Unfortunately, there's still some concerns around liability, some fixes that we'd like to see, and the committee needs to do some more work. So they've sent that back to the subcommittee to continue working on a resolution. We're still hopeful that in the coming weeks they'll be able to find a solution that works for all interested parties, and we'll continue to bring you updates on that. But at the end of the agenda, two of our other priorities, hallway bed legislation related to our ability and our hospital's ability to put a patient in a bed outside of a patient room during emergencies, passed out favorably. Really grateful for the chairman's leadership, Senator Verdon's leadership on that front. There was a slight amendment just kind of clarifying who could designate that an emergency existed and allow the use of those beds. And then another bill around a rural emergency hospital designation passed out. This is a federal designation from CMS that allows a hospital to receive a higher Medicare payment, but it does come with some trade-offs. You can't have inpatient beds in use, and some other kind of back and forth between current licensed hospital inside South Carolina, which is purely related to inpatient beds, versus this new potential designation that would allow a hospital to maintain its emergency room and some outpatient services in areas that need that critical service that wouldn't otherwise maybe have that flexibility. So again, grateful for the chairman and the Senate leadership for advancing that bill on our behalf. That bill will be heard in the House subcommittee next week, next Tuesday, I believe, on in the Ways and Means subcommittee, and so we look forward to that subcommittee advancing the bill on the House side as well. The House was out this week. They debated the budget last week, and they took a furlough week this week. Senate Finance subcommittees continued their work on development of the State Appropriations Act. They're advancing towards their full committee deliberations, and will take up full committee debate the first full week of April, starting April 7th. Really hopeful that the Senate fully funds the Medicaid budget. We've talked to you about that in the past. The House passed version includes 175 million of the 203 million requested, and we're asking the Senate, if they can, to go above that 175 to the 203 point. But they're going to have a difficult time doing that. They've passed some tax cut bills that will seriously reduce the amount available they have to allocate in their budget, but we'll continue to advance our goals of fully funding that budget, and ask for you to engage with your senators in the coming weeks. Look for future grassroots campaigns from us on that front. We didn't have a hospital of the week this session because the House was out. Next week, we're going to see Prisma 2 days. Their Midlands division and their Upstate division will be there Tuesday and Thursday, respectively. and look forward to their presence. Really, again, grateful for all the turnout and support we've seen from you all. And then lastly, we asked you for some feedback. Really appreciate the responses we received. Hopefully, you appreciate the new kind of written version. We're attaching below the video here. Thanks to the team for compiling that for me, since most of this is off the cuff. And included, you're also going to see a bill tracker. So a list of all the bills that we're monitoring. You'll see quickly how few of those are actually moving if you look down the list. But at the top, you'll see which ones we're supporting and hoping to advance. I saw a statistic just last week where the General Assembly only passes about 6% of all the bills filed. You'll see the percentage of those that we're tracking and the ones that we're asking you to engage in. So that's all for week 10. We'll catch you next week on In Session. Thanks.